Guys, welcome to the lecture, and today we are going to describe about glossopharyngeal nerve. Glossopharyngeal nerve is a type of mixed nerve because it has both sensory and motor fibers, and it has total 5 components. These are spatial, visceral, afferent. First of all, go through efferents. Spatial, visceral efferents. Second one is general visceral efferents. Third one is spatial visceral afferent. Fourth one is general visceral afferent, and fifth one is general somatic afferent. It is same as facial nerve. So we are going to describe about glossopharyngeal nerve, and first of all let's go through very first component of the glossopharyngeal nerve. This is a spatial visceral afferent, and this nerve arises from the nucleus ambiguous present in medulla oblongata, and these nerves the spatial visceral afferent fibers moves and come out in the medulla in the posterolateral sulcus between inferior cerebellar peduncle and inferior olivary nucleus, and these nerves continue and then in the middle cranial fossa and then comes down in the jugular foramen. Later we will also describe about the contents of jugular foramen. For now we are going through the spatial visceral afferent fibers. These fibers come down and then it goes to supply a muscles called stylopharyngeus. Stylopharyngeus is a muscles which origin is from styloid process, and insertion is at thyroid cartilage, and it helps in movement of upward movement of pharynx during swallowing and speaking or phonation. This is about the spatial visceral efferent fiber. Then let's go through another component of this nerve, and this component is general visceral efferent, which arises from, as it is a parasympathetic fibers, it arises from inferior salivatory nucleus, which is present in pons and then comes in the medulla, and these fibers continue from the inferior jugular vein, and as it is a pseudo unipolar neuron, there is a geniculate ganglion, and its peripheral process comes down up to the tympanic canaliculi present in floor of middle ear, and then gives branch to promontory in the medial wall of middle ear, and it also accompanies the sympathetic fibers and forms the tympanic plexus. Tympanic plexus supplies all the mucus lining areas of the middle ear like eustachian tube, bony part, eardrum, and tympanic cavity. After that, this branch, tympanic branch of glossopharyngeal nerve, tympanic branch is also known as Jacobson's nerve. And then this fiber come out the middle ear, and along with these sympathetic fibers, the fiber continues as a lesser petrosal nerve, and it goes in the cranial cavity in the middle cranial fossa through the hiatus for lesser petrosal nerve, and then these fibers come out of the cranial cavity through foramen ovale, and then accompanies the auriculotemporal branch of mandibular nerve, and these fibers relay in otic ganglion, and after that post-sympathetic fiber supplies to the parotid gland. Okay, this lesser petrosal nerve communicates with greater petrosal nerve through a communicating branch, and this is all about the general visceral efferent fibers of glossopharyngeal nerve. Let's go through general visceral afferent fibers. General visceral afferent fibers has a central process as a nucleus, tractus solitarius, and dorsal nucleus of vagus, and from this fiber continue again relays in this inferior ganglion, come out through the jugular foramen, and then this fiber gives two branches, that is superior laryngeal branch and recurrent pharyngeal branch. This superior laryngeal branch supplies to the muscles of larynx or receives general sensation from the muscles of larynx, and this general visceral efferent fibers have huge supply to the it carries huge sensation from general sensation from huge areas, that is larynx, pharynx, also from these tonsils, larynx, pharynx. Another is soft palate, another is hard palate, soft palate, tonsils, larynx, pharynx, and also from carotid body, that is chemoreceptor, and carotid sinus, that is baroreceptor, and another also from the uvula. These are the general visceral afferent fibers. And another components, let's go through spatial visceral afferent. Spatial visceral afferent comes from the upper part of nucleus tractus solitarius and then continues to come in jugular foramen and relay as inferior ganglion, and again continue to supply to the and get supplied to posterior one third of tongue to receive spatial sensation, that is taste, and it carries taste from posterior one third including circumvallate papillae. This is all about spatial visceral afferent fibers or sensory fibers. And very last one is general somatic afferent fibers. And general somatic afferent fibers arises from the nucleus of or get supplied to the nucleus of spinal nucleus of trigeminal nerve, and again and comes down and relay as superior ganglion, or it is some book has mentioned it as inferior ganglion or as a part of inferior ganglion, so that's not a great deal, and it comes down and supplies to the external ear, auditory meatus, and inner part of eardrum. It may also receive proprioception from the stylopharyngeal muscles, and this general sensation relays as superior ganglion, and then comes to the central process of as a central process in the spinal nucleus of trigeminal nerve. This is all about the branch and distribution of glossopharyngeal nerve, and I would like to go through the contents of jugular foramen. And contents of jugular foramen are cranial nerve. First one is accessory vagus nerve, then there is vagus nerve, and then this is accessory vagus, this is vagus, and this is glossopharyngeal nerve. And another part is that inferior petrosal sinus, and then there is internal jugular vein, posterior ascending artery, and occipital artery. They are both branches is meningeal branch. Okay, and then there are two emissary veins. So you can go through mnemonics for this, and this is copies. 3 cranial nerves, occipital nerves. The second one is occipital artery. This is ascending pharyngeal artery. This is inferior petrosal sinus. This is emissary vein, and this is internal jugular, and this is the content of jugular foramen. And then let's go through the another part of this nerve, that is clinical correlation. Very first one is Eagle syndrome. In this case, styloid process get longer, or styloid ligament get calcified to compress cranial nerve. 9 occurs mainly in case of occurs tonsillectomy, post tonsillectomy, after tonsillectomy this Eagle syndrome may get. And another is styloid fracture. This may get occurred and rupture that glossopharyngeal nerve. And another condition is internal carotid artery endarterectomy. When atherosclerotic plaque get more than 2 centimeter, then during its removal, plus while removing the plaque, this procedure is done and leads to lesion of this nerve. Although very more common is 11, then 10, and then 9 to this lesion. And another is glossopharyngeal neuralgia. First syndrome is Barnett syndrome. It is also known as jugular foramen syndrome, and this occurs due to tumor in compression of nerve during tumor in jugular foramen, or osteomyelitis in jugular foramen, or any other infections. Okay, then there is syndrome. These same conditions occur near hypoglossal canal, or near or in between them. So what will be the clinical features during these conditions? Mainly there will be dysphagia, because cranial nerve 9 is getting damaged, so dysphonia, gag reflex will be absent. Do you know about the gag reflex? Actually this is a reflex to check about this vagus nerves and glossopharyngeal nerve. When we stimulate or trigger posterior wall of pharynx from these afferent fibers are cranial nerves 9. These get stimulated and leads to contraction of soft palate, and then in this condition afferent are cranial nerve 10. This is about the gag reflex, which will be absent in the lesion. So another, there will be absent negative carotid reflex, because carotid body and carotid sinus will want to be able to send their sensory information. These are the conditions which may get arise during the lesions of glossopharyngeal nerve, and also the taste sensation will be negative taste sensation from posterior 1/3. So hope you have enjoyed this lecture, and thanks for joining us.